Hello everyone. Today we'll discuss about the female reproductive system. See this female reproductive system. The female reproductive system is part of the reproductive system. In the last class we have discussed about the male reproductive system, isn't it? Okay, right. Next come to the female reproductive system. In this female reproductive system, we are going to learn about the organs what are present in the female reproductive system and what are the primary organs and what is the gonad, what is gamete and what is menstrual cycle, what is puberty, what is pregnancy, how will determine the pregnancy and what are the contraceptives and what is the family planning methods. All this we are going to learn in this female reproductive system. First, come to the organs what are present in the female reproductive system. If you see the organs, there are two types of the organs are present. One is external organs and internal organs. In case of the internal organs, again it divided into two types. One is primary organs and another one is accessory organs. The primary organs is the ovary. Ovary is a female reproductive organ which produces the gametes. That in the sense, ovary is a gonad which produces the gametes. In case of female reproductive system, gamete is ovum. Ovum is the gamete in case of the female reproductive system. Okay, that is the primary organ produces this gamete. Okay, so that ovary is the primary organ. And next come to the accessory organs. We have fallopian tubes, uterus, cervix and vagina. These are the accessory organs. In case of the internal organs it is. And whereas come to the external organs, there is labia majora, labia minora and the hymen layer and all these present in the outer part. Okay, right, that is what external genital organs. And next one is, if you see the diagram, so we can observe all the parts of the female reproductive system here. Okay, the uterus and next one is it connected to the two fallopian tubes and that two fallopian tubes is connected to the ovary and next. So that is innermost part. Ovary to fallopian tube, fallopian to uterus, uterus to cervix, cervix to vagina and then external genital part, that is what the labia majora, labia minora. Okay, right. And next, if you see the functional anatomy of this, okay, uterus, cervix, vagina. First come to the uterus. If you see the uterus, it is composed with the three types of the layers, endometrium, myometrium and the perimetrium. Three types of the layers are present in this. Okay, so endometrium, this is the innermost part, endometrium, and next myometrium and next is the perimetrium. Okay, right. And here next one is cervix. This uterus connected to the fallopian tubes and that fallopian connected to the ovaries. Okay, right. Next one is cervix. Cervix is the head of the, is present in the head of the uterus. Okay, cervix is present on the head of the uterus. That in the sense it is the opening of the uterus it is. Okay, and next one is vagina. This vagina is the next part of the cervix, that is in the sense outer opening into the of the female reproductive system. Okay, right, that is what that. And next, if you see this diagram, so first the internal genital organ starts with the vagina and next is it connected to the cervix and connected to the uterus and that uterus is connected to the two fallopian tubes and then there is a fimbriae are present like the fingers, fimbriae are present and that fimbriae so binds with the ovary. A pair of ovary are present in the female reproductive system. Okay, right. And next is, so puberty. Puberty is the most important thing in case of the males and at the same time in case of the females. What is puberty? Puberty is development of the secondary sexual characters. Nothing but adolescence. Okay, puberty is development of the secondary sexual characters. This is in the both males and at the same time in the females. Okay, in case of the males, it occurs in between the 10 to 16 years and whereas come to the females, it is in between 8 to 14 years. Okay, right. What is this? What happens in this puberty in the sense? The sexual hormones production starts. In case of the female reproductive system, or in case of the female person, there is production of the estrogen and the progesterone hormones, and by that the female characters are developed. And next, in case of the males, so after this, at the time of this puberty, there is production of the testosterone hormone. It is a sex hormone in case of the males, and then there is a production of the testosterone, and at the same time development of the male sexual characters. Okay, what are the male sexual characters? Musculature development and beard. Okay, and next voice, bass voice is increased. Okay, and next pubic hair, axillary hair is growth is started. Okay, that is in case of the males. And whereas come to the spermatozoa production is started. That's what the spermatogenesis. Okay, and next, female reproductive system. In case of the female persons, what happens at the time of puberty? In the sense, so pubic hair's growth, axillary hair growth, and production of the hormones like estrogen and the progesterone, and the menstrual cycle it starts. Okay, and next one is oogenesis starts. Oogenesis is nothing but the production of the oocyte is called as the oogenesis, and the starting of the menstrual cycle is called as menarche. Menarche starts at that is the indication of the puberty. Okay, so and next the voice get deeper and the development of the breast. All these are the characters present in case of the female person at the time of the puberty. Okay, right, and next after this puberty, so sexual life cycle in case of the females. There are three type of the periods are present in case of the female reproductive system, that is first period, second period, and the third period. The first period is starts from the birth to till the puberty, that in the sense starting of the menstrual cycle at the time of menarche. Okay, so that is the first period, and second period is from the menarche to menopause, starting of the menstrual cycle to stoppage of the menstrual cycle is the second period, and next one is third period, that is after the menopause. Remaining life cycle is with us, that in the sense after the menopause. Menopause occurs at the time of 45 to 52 years in between. That in the sense in between that age there is completely stoppage of the menstrual cycle. These three types of the periods are present in the female reproductive system. Okay, right, and next one is, if you see this, ovary. Okay, ovary is a gonad in case of the female reproductive system. It is the primary organ which produces the gametes, that in the sense oocyte. If you see this ovary, so it produces in different stages of that oocytes we can observe here. Okay, later on we'll discuss what is this oocyte production. Okay, so just think about that ovary. Okay, it is a part present in the abdominal cavity. Okay, and ends of the fallopian tube attached with the fimbrium. Okay, and next one is oogenesis. Oogenesis is nothing but the production of the oocyte. Okay, right, this oocyte production starts with the primary oocyte. Okay, primary oocyte so get matured and it gives two types of the cells, first polar body and the second polar body. First polar body and the second polar body, which comes from the matured primary oocyte. Okay, and next one is, so this secondary oocyte and the first polar body. Okay, so and next here from that there is production of the matured ovum. This is what the oogenesis. Okay, matured ovum and the polar bodies comes from the secondary oocyte and the first polar body. Okay, so that is what the oogenesis. And after completion of this oogenesis, for the oogenesis and every process and every development, it requires hormones, reproductive hormones or the sex hormones. The female reproductive hormones are produced by the ovaries. A pair of ovary produces two types of the hormones, that is one is estrogen and another one is progesterone. Okay, and next, menstrual cycle. So after this, so when the puberty starts, okay, that is indication of the puberty. So starting of the menstrual cycle is the indication of the puberty. Okay, that starting of the menstrual cycle is called as menarche. So here we should observe one thing. Okay, so all the oocytes are produced before the birth of the female. After this menstrual cycle, that in the sense after the menarche, during the menstrual cycle, so one ovum is released from the each ovary alternatively. 1 month from this ovary and another month from this ovary. Alternatively it releases. Okay, right. What is menstrual cycle? Menstrual cycle is a cyclic events in the female reproductive system. So that releases the ovum, and it is a cyclic process for the every month. So it is in between the 25 to 40 days of the cyclic period it is. Okay. In this, so many changes occurs, like in the female reproductive system, vaginal changes, cervical changes, uterine changes, and the ovarian changes are occurred during this menstrual cycle of the every month process it is. Okay, and next, so what are the changes? The majorly there are two types of the changes we have. One is ovarian changes and another one is uterine changes. In case of normal woman, so 28 days is the normal menstrual cycle period. During this 28 days, what happens? Now we'll see. See, so there are 3 phases in case of the uterine changes, and 2 phases in case of the ovarian changes. See this diagram once. Okay, 0 to 4 days there is rupturing of the endometrium of the uterus, and then there is a bleeding occurs. The normal bleeding blood during this menstrual phase, that in the sense 0 to or the 1 to 4 days, is about 30 to 100 ml. Averagely it is about 50 ml of the blood is lost due to the rupturing of the endometrial layer. There is also rupturing of the blood vessels, so that there is bleeding occurs. Okay, and next, after the 4th to 14th day, so there is proliferative phase, or it is also called as follicular stimulating phase it is. Okay, so during this period what happens? There is reconstruction of the endometrium starts, and also blood vessels. Okay. On the day of 14th, there is ovulation occurs. Ovulation in the sense releasing of the ovum from the ovary, and it takes 3 to 7 days to come into the uterus from the ovary through the fimbriae, fallopian tube, and finally it enters into the uterus. It takes 3 to 7 days. Okay, and after this 14th day to 28 days, what happens? Complete constriction of the endometrial layer and the blood vessels and everything. Okay, so that is what the secretory phase or the luteal phase it is. Okay, come to the individual phases. So Graafian follicle. What is this Graafian follicle? Graafian follicle is a follicle which surrounds the oocytes. Okay, oocyte is covered by a follicle that is called as Graafian follicle. So how this Graafian follicle is developed, later on we'll see. And next, so come to the by hormones, this regulation of the menstrual cycle is possible. So like there are 4 types of the hormones are functioning in this regulation of the menstrual cycle. One is FSH, which is produced from the anterior pituitary gland, and another one is LH, which is produced from the same anterior pituitary gland, and estrogen, which is produced from the ovary, and progesterone, which is produced from the ovary. 0 to or the 1, day 1 to day 14. So is this cycle, day 1 to day 14 days, is maintained by the estrogen and follicular stimulating hormone or FSH. And on the day of 14th, the hormone levels are increased. And immediately on the day 14th, estrogen levels and the FSH levels are decreased, and immediately there is raising of the progesterone and the LH, luteinizing hormone. progesterone and the luteinizing hormone, which is also called as LH. So these two hormones from the day 14 to day 28. Okay, so by this actioning of the two hormones 0 to or the day 1 to day 14, that is estrogen and the follicular stimulating hormone, and day 14 to day 28 progesterone and the luteinizing hormone. Okay, so like this there is regulation of the hormones is possible. And next, so how will come to know? So menses is started. Okay, there is somewhat symptoms are there like abdominal pain. So before getting the menses, there is abdominal pain is present, and next one is dysmenorrhea, that in the sense menstrual pain it is. During the bleeding there is a menstrual pain, and after that headache, and next occasionally sometimes vomiting occurs, and sometimes they'll feel nausea. Feeling of the vomiting is nothing but nausea it is. Okay, and next one is irritability, irritations. Okay, and next depression, migraine. Okay, mood swinging. All these are the symptoms in the menstrual phase. First 5 days it is. Okay, and next premenstrual syndrome. That in some of the females, so this premenstrual syndrome occurs before getting the menstrual cycle, that in the sense when the menstrual phase is getting started, so at that time, so there is premenstrual syndrome is occurs. In that there is abdominal pain and premenstrual stress occurs, and next 4 to 5 days prior to the menstruation, all the same as like the, so what are the causes to the menstruation, all those are occurs in this PMS, premenstrual syndrome it is. Okay, and salt and the water retention caused by the estrogen, so that this premenstrual syndrome occurs. Okay, and next one is, so the common features of this premenstrual syndrome is, so mood swinging, anxiety, irritability or irritation, and next emotional instability, emotional outburst, headache, sometimes nausea, depressions, constipation, abdominal paining, and the bloating, that is what the abdominal swelling it is. Okay, and next, so abnormal menstruation. So what is this abnormal menstruation? In the sense, during the menstrual cycle, if any abnormality is present, that is the abnormal menstruation, isn't it? Okay, so first one is amenorrhea, and next one is hypomenorrhea, and next menorrhagia, and next oligomenorrhea, menorrhagia, and next dysmenorrhea, and next metrorrhagia. Amenorrhea in the sense, so absence of the menstrual cycle, and next hypomenorrhea in the sense frequency is decreased of the menstrual phase, and next one is, so menorrhagia in the sense the frequency in the cycle is decreased, menstrual phase frequency is decreased, and the oligomenorrhea in the sense the bleeding is decreased, and next polymenorrhea in the sense the bleeding is more, and next dysmenorrhea in the sense of discomfort and the pain and the depressions, all this comes into the dysmenorrhea. And so metrorrhagia is one of the, so with all these causes. Okay, and next one is ovulation. After all this menstrual cycle, on the day of 14th menstrual cycle occurs, isn't it? This menstrual cycle, so for the 28 days of cycle it is, in between that on the day 14 the ovulation occurs, and so day 1 to day 14 some hormones like estrogen and the follicular stimulating hormone which develops a Graafian follicle, and on the day 14th that developed Graafian follicle is released through the fimbriae into the fallopian tube from the ovaries. Okay, and from the day 14 to, it will take 3 to 7 days to completely enters into the uterus, and then there is, if there is spermatozoa is present, fertilization occurs. If it is not, so it forms corpus luteum and corpus albicans or albicans. Okay, and so this process of the ovulation, all the types of the, so this oocytes are produced before the birth of the female reproductive system, that is female birth. Okay, Right. And next, so hormonal regulation of this ovulation. If you see this, okay, so day 1 to day 14, luteinizing uh, estrogen and the follicular stimulating hormone, and on the day 14th progesterone and the LH. So these two are increased, and immediately there is suppression of the estrogen, and on the day 14 this ovum is released. Okay, and next day 14 to day 28 it is maintained by the progesterone and the luteinizing hormone. Okay, right. The lifespan of the ovum is about the 48 hours, and spermatozoa lifespan is also 48 hours. Okay, right. And next, if you see how it moves, in the sense, the movement of the Graafian follicle to the periphery of the ovary. Okay, and next, so after that, formation of the new blood vessels in the ovaries. After that, there is protrusion of the blood vessels into the follicular wall, and immediately increased blood flow in the follicle. And next, so leakage of the plasma in the follicle, and next swelling of that follicle. Because of that, so over blood flow. Okay, so there is swelling of the follicle, and the protrusion of the follicle again is the ovarian corpuscle. Okay, and then formation of the stigma of the ovarian corpuscle. Okay, and here it divides into two types. Okay, so one is so weakening and the rupturing of the follicle and the follicular corpuscle, and next so immediately oozing of the follicular fluid, and finally that is a result, and then so releasing of the ovum occurs. And by another method is degeneration of that stigma, so which is formed so by the protrusion of the follicle against the so in the ovarian corpuscle. Okay, so degeneration of that stigma, and it causes the oozing of the follicular fluid, and then there is a releasing of the ovum. Okay, and if you see this, okay, so at first primary follicle, so which is developed, and after that development, so it is converted as the secondary follicle, and secondary follicle so converted as the vesicular follicle, and next there is ovulation, that is Graafian follicle, and after that if the fertilization occurs, that Graafian follicle is ruptured and the oocyte met with the spermatocyte, and then the fertilization occurs, implantation occurs. If it is not, it forms corpus luteum and corpus albicans, and it is degenerated. Okay, and this is what the process of ovulation and the degeneration of that ovum. Right, and next one is so determining the ovulation time. How we determine? In the sense, determining the body temperature is the first thing, and next so basal body temperature it is. Okay, and next determining the hormonal so excretion in the urine. This is also one of the determining, and next determining the hormonal levels in the plasma, that is called as LH surge. Okay, so the luteinizing hormone and the progesterone hormone levels are increased at that time of the ovulation. Okay, and next one is ultrasound. By ultrasound scanning also will come to know this determining the ovulation. And next another one is cervical mucus is present. Okay, it is somewhat thickish at the time of ovulation. Okay, and next significance by this determining the ovulation time, those in case of the infertility females. Okay, so by determining this they can fertile. Okay, so by the process. Okay, and next one is so menopause. What is menopause? It's completely stoppage of the menstrual cycle is called as menopause. This occurs at the age of 45 to 52 years in between of the female cycle, female reproductive system cycle. Okay, that in the sense. So what is cause of this menopause? In the sense, the estrogen production is completely suppressed, and the production of the estrogen is decreased. Due to that, there is no menstrual phase, there is no menstrual bleeding, and due to that, there is menopause occurs. Okay, and what are the changes during this menopause in the sense? Okay, so estrogen, the first one. Okay, and symptoms like menstrual cycle is stopped. Okay, and sometimes by the emotional outbursts and all these are present. So we'll come to know later. Okay, and treatment hormonal replacement by the HRT, hormonal replacement therapy, that in the sense administration of the estrogen. Okay, so by that they can somewhat curing of this menopausal syndrome symptoms. Okay, and next one is, so here, infertility. What is this infertility? So spermatozoa is okay and the ovum is okay. Then there is fertilization occurs. Okay. What is fertilization first of all? Fertilization is nothing but at the time of the ovulation or the, so before 2 days of that, okay, so mating of that ovum with the spermatozoa is called as fertilization. And then there is implantation occurs. This fertilization mostly occurs in the fallopian tubes itself, okay, and the implantation occurs in the uterus. That fertile ovum, so that fertile ovum comes or the enters into the uterus and it select a place, okay, so that selected place of that where it is going to implant is called as decuda it is, okay, and there it is implanted, and then that is the generation of the so egg and the embryo and next fetus and the baby and next parturation and all this process occurs. Okay, and next, so infertility in the sense by the abnormal things, that in the sense spermatozoa may be abnormal morphologically, it might be, or the count is decreased, and all the causes like, so spermatozoa as according to the spermatozoa or according to the ovum, abnormal conditions, by that there is infertility occurs. Okay, so that is what infertility. And next one is pregnancy. So if everything is okay, then so at the time of ovulation, then there is fertilization is occurs, and that female gets conceived, that is called as pregnancy. Pregnancy is the development of this embryo is called as pregnancy, and developed as the fetus, and finally there is a birth, that is called as the parturation. Okay, and here fertilization of the ovum occurs and the sexual hormones and the chromosomes and the, so by the determining all this will come to know pregnancy or the that particular female is conceived or not. Okay, and next implantation occurs as well as, so in the uterus, the place is called as decuda, and next development of the placenta from the embryo to, so this female reproductive system. Okay, and next, so what happens, just see this diagram, day 1 to day 7 or 8 or 9 days, so how it going to develop we can observe easily. Okay, so day 1, that from the ovary, that oocyte is released through the fimbriae, it enters into the fallopian tubes and slowly, so on the day 2 it fertile with the spermatozoa, and next on the day 7 or 8 it implanted in the uterus. We can observe clearly in this diagram. Okay, and next one is, so the maternal changes during the pregnancy. What happens during the pregnancy in the sense, so all the systems gets changed and the structural changes also occurs. Okay, so and next increased in the body weight obviously. Okay, and next metabolic changes also increased, BMR is increased, BMI is increased, and the body weight is increased due to all this. Okay, so BMI is obviously it is increased. Okay, and next, so changes in the physiological system, CVS, cardiac output is increased, blood pressure is increased, respiratory system, so the breathing rate of respiration is increased and taking of oxygen is increased. Okay, and next digestive system, taking of the food is increased and the digestion process is increased, and in case of excretory system the urination is increased because of the stress or the pressure on the urinary bladder by the uterus. Okay, and next is gestation period. What is this gestation period? Gestation period is nothing but, so when the delivery occurs, okay, that is called as expected date of delivery. Okay, so by the ultrasound scannings, we'll come to know this gestation period, expected date of delivery it is. Okay, and next one is the parturition. The delivery of the baby is called as parturition. So there are some of the reflexes are present. So one is Braxton Hicks contractions. So whatever it is, just the thing is, so what contraction of the uterus by the oxytocin releasing. Simple it is. Okay, so the first one is Braxton Hicks contractions, and next false labor contractions. Sometimes, so like the fetus or the baby, so the particular female, that particular pregnant lady feels like that baby is coming out. Such type of the contractions is called as false labor contractions. And next one is, so there are some of 3 stages of the parturition are present. The first upper movement or the upper contractions are present in the uterus, and next middle and next lower part of the uterus, and slowly, so first head comes outside, and next, so upper limbs, and next stomach and the lower limbs. Okay, so this is what the process. Okay, and next, so role of the uterus takes major role in case of this. So by the releasing of the oxytocin from the hypothalamus to posterior pituitary, and that posterior pituitary releases that oxytocin into the bloodstream, and then there is a contraction of the uterus occurs, and by the uterine contraction in 3 stages, stage 1, stage 2 and stage 3, the fetus will come outside. That's what the delivery of the baby. Okay, the cervix role in the sense, so in case of that cervix role, it is dilated. Head of the cervix gets dilated for the convenience for the parturition process or the delivery of that baby. Okay, and next one is role of the hormones. So here the estrogen is completely suppressed. Okay, so that there is no menstrual cycle again. So from the date of conceiving to till the after parturition till 3 to 4 months, there is no menstrual cycles are present because of this suppression of the estrogen. At time of this, immediately the prolactin gets activated, and then milk production starts by the releasing of the oxytocin. Okay, and next, so placenta. What is this placenta? It's a barrier between the mother and that fetus. Everything is transported by this placenta. Okay, so it is a barrier between that fetus and the mother. Okay, so food material or nutritive substances or gases, blood, everything is supplied through this placenta into the fetus. Okay, so it is a communication barrier actually. Okay, and if you see the functions of this placenta, okay, so one is the nutritive functions, it supplies the nutritions to the fetus, and the excretory function, so the excretion from the baby comes through the placenta, and next respiratory functions, supplying of the gases to the fetus through the placenta, and next endocrine functions, the hormones which are required to that baby, okay, or the fetus, okay, so are supplied through the bloodstream of the placenta. Okay, and next pregnancy test. How will come to know? There are 2 types of the test. In the olden days, they'll go with the biological test like Kupferman test, Hochben test, Zondek test, like this type of the test. Okay, now we are using the immunological test and the strip method tests we are using. Okay, so and next one is mammary glands and the lactation. Okay, so after the parturition, immediately on the day 2, so there is lactation starts. Okay, this mammary glands development starts from the puberty, and it is ready for the secretion and the ejection of the milk. So when there is pregnancy occurs, immediately the prolactin releasing is stopped. Okay, so after the parturition, the estrogen stopped, so that immediately there is activation of this oxytocin, and there is secretion of the milk by the activating prolactin, and the milk ejection by the oxytocin. Okay, and next, this development of the mammary glands, after that, hormones involved in this is prolactin, oxytocin, progesterone. These three are the major hormones which influences the milk secretion and the milk ejection. Okay, and the lactation is the nothing but the production of this milk and the that particular milk is feeding to the baby is called as lactation. And next, breast milk is the most important one, so which supplies the immunoglobulins to the baby after the parturation. The mother milk is more or much better than the animal milk. Okay, right, that is for that. And next, if you see this lactation, okay, milk secretion and the milk ejection, and by the lactogenesis and the galactopoiesis. Lactogenesis and the galactopoiesis. Lactogenesis by the prolactin and the galactopoiesis by the prolactin growth hormone and the thyroxine and the cortisol. And next, so milk ejection by the milk ejection reflex, which is influenced by the oxytocin. Okay, next is fertility control. This is also called as family planning methods. These are in two types. So one is long term, that in the sense permanent, and another one is temporary methods. So how this fertility control is possible in the sense, first one is rhythm method. Rhythm method in the sense, so during the ovulation period, that in the sense ovulation period is on the 14th day, that in the sense spermatozoa is lifespan is about 48 hours and the ovum lifespan is about 48 hours. On the day of 14th, the ovum is released, so that 12th day to 16th day is the dangerous period. So in this, so the pregnancy occurs. Just avoid the sexual intercourse participation in between this, that in the sense 11 to 17 days. So if the particular person stop this sexual intercourse participation, then that in the sense remaining period, that is day 17 to day 11 is the safe period. Okay, this method is called as rhythmic method it is. Okay, and next, mechanical barriers, so and the chemical methods, so which prevents the entry of the spermatozoa into the uterus, like cervical caps. Okay, so these cervical caps are nothing but the caps. So on the head of the cervix, these caps are present, and there is no passageway of the spermatozoa into the cervix, and there is no way to pass into the uterus. Okay, and next one is chemical methods. If you see these chemical methods, the oral contraceptives, nothing but the pills method it is. Okay, there are three types of the methods, three types of the pills are present. One is classical or combined pills, and next one is sequential pill, and next one is mini pills. Okay, classical pills taken from the day 5 to day 20, and next sequential pills from day 5 to day 15, and next mini pills all over the menstrual cycle period, for that in the sense day 1 to day 28. So total during the menstrual cycle that tablet should take. Okay, so that is for the mini pills. And next, by this disadvantages of this contraceptive pills or the pills method is that, so when that particular female want to conceive, it may not possible sometimes. Okay, and if any day in between this, so if that female forget to take the pills, okay, there is chance to get the pregnancy. These are the disadvantages of the so taking of the contraceptive pills. And next one is long-term contraceptives is, so one is IUCD, intrauterine contraceptive device. So it is most common used one, and if you see this mechanism of the IUCD, the copper T, it is nothing but the copper T it is. Okay, so copper has an action that kills the spermatozoa's motility. There is nothing, so after that kills the motility in the sense there is no movement of the spermatozoa, by that it won't reach to that ovum and there is no fertilization occurs. Okay, and next, disadvantages with this, so during the sexual intercourse it may sometimes it may induce the penis, and it's during the working of that female, okay, so it may comes outside and it gives her most discomfortability, so during the working or during the sleeping and in that, so daily life cycle. Okay, and next, another method is MTP, medical termination of pregnancy. This is also called as abortion. Okay, so in that, the first one is dilation and curettage, that in the sense dilation of the cervix and the vagina and removal of the fetus, that is called as D and C technique. So dilation and curettage it is. Okay, and next one is administration of the prostaglandin. So PGF2 and PGE2. Okay, so by these two administration, drugs administration, the fetus death occurs, and that is also one of the method in case of the MTB or the abortion. Okay, and next one is, so the surgical methods are in two types in case of the males, that is vasectomy, cutting of the vas deferens, and they make a knot in two ends of that vas deferens, and there is no movement of the spermatozoa from one end to another end because of that making of knots in the two edges. Okay, and that is in case of the males. And another method in case of the female is the tubectomy. That is also one of the permanent method. So this is in case of the female. Vasectomy in case of the males, and the tubectomy is in case of the females. So vas deferens cutting in case of the males, and the fallopian tube cutting in case of the females. Okay, so fallopian tubes cut in the both ends, and they'll make a knot, and so by that the ovum is not transported into the uterus, and immediately there is stoppage of the conceiving or the fertility. These are the fertility controls, and this is about complete reproductive system as per my knowledge. And thank you very much.